future, talk radio will actually educate, inspire, and make you think. The future is now. Topics and music that affect your life from Universal Broadcasting Network. Tune in at ubnradio.com.
And greetings and salutations, everyone. You have tuned into Dr. Judy, WTF, which this week stands for What the Freud. And I'm your host, Walt Lusk, and in studio shortly, she had a lot of patience today, is Dr. Judy Rosenberg, who's got an amazing system called the Mind Map, which is an amazing system to basically work through healing human disconnect, which is the byline of our show. The title of our show this week is entitled Teen Plastic Surgery. We did a show back in 2013 early on called Makeover, Fakeover, if you want to do a little homework on plastic surgery in general. It was a two-parter. And you can pull those, I believe they're on YouTube and Stitcher and iTunes and, of course, here at UBN. And if you have any questions for shows, you can write us at info@drjudywtf.com. And we've got an interview we're going to play that Dr. Judy did for People magazine, but I thought I'd start a little bit about teen plastic surgery. 40% of all plastic surgery is done over the summertime because it's see you in September because I'll have a new set of something or other or a new face when school starts the following year, kind of a fresh start thing. They're putting their best face forward in the fall. Over 250,000 procedures are done on an annual basis for teens. It's only about 2 or 3% of all procedures. There's close to 16 million plastic surgery procedures done every single year. And more teens are having work done just because, you know what, it's a trickle down from social media and reality TV. And it's just amazing how things have done. And it's virtually unheard of 5 years ago that things were done in this way. Some people are making it analogous to getting your braces done. Well, I'm going to get my braces done, so I might as well get my breasts done and my nose fixed. Two very popular plastic surgeries, of course. Did you ever look in the mirror and think your face would be okay if it weren't for your nose? Maybe you feel your ears stick straight out and nothing you can do to hide them. Perhaps you're self-conscious about your breasts being way too large, or maybe you've had a bad case of acne that has left scars and pits in your face. If you're self-conscious about a physical characteristic, you may be among the thousands of teens who consider plastic surgery every single year. And so that's really the questions and the challenges and the issues, let alone the fact that and we're going to play a little clip here from Dr. Judy, who just sauntered in.
Hello.
Hey, Dr. Judy. Thanks for being in the neighborhood.
The wrong headpiece here.
Okay. Kylie Kardashian, for those of you that keep up with the Kardashians, now has pouty, puffy lips. And
no sound.
You can't hear
Okay.
anything? Can you hear me now?
Yeah, I don't know.
Can you hear me now?
Yeah.
Okay.
Okay, I think so.
And so that's been a big uproar, and let alone the fact that her father or stepdad and mom have had plastic surgery. I mean, we did a whole show on Bruce Jenner, or as one person called it, Bruce Gender, but anyway. So thanks for tuning in. We really appreciate it. And we're gonna start with a clip.
Yes.
That Judy did for People magazine. Or People?
No, actually,
and People
Huffington Post.
Oh, Huffington Post.
Yes.
Excuse me. Well, fire away. What do you want to set it up a little bit?
Yeah, they were looking for an interview on plastic surgery and the appropriateness of it, and when it is okay to go ahead and go under the knife, and when it's just a little too much. And so I was with a really very, very wonderful team of plastic surgeons and a mother and a daughter. The daughter had just undergone plastic surgery, and then we'll discuss.
All righty. So here we go.
You're watching HuffPost Live. I'm Alona Minkowski. September means back to school. And this year, more students than ever headed to class with new looks. But for some, a new look entailed more than just new clothes. Experts say that summer break is the most common time for teens to undergo plastic surgery, since it allows patients time off to heal. The American Society of Plastic Surgeons reported that nearly 64,000 cosmetic surgery patients in 2014 were 13 to 19 years old. And the number of procedures in that age group is on the rise. But why? Joining us now to discuss the reasons behind the surge in teens going under the knife, we have Dr. Andrew Giacono, a dual board-certified facial plastic and reconstructive surgeon, Dr. Anthony Yoon, a board-certified plastic surgeon, Kayla Ann, a teenager who had plastic surgery, and her mother, Christina Healy, and Dr. Judy Rosenberg, a clinical psychologist. So I want to welcome everyone and thank you all for being with us today. And Dr. Giacono, I'd like to start with you. And if you could just walk us through what's going on here. Are you seeing more teens in your practice?
Yeah, over the last, I'd say, 3 to 5 years, I've seen a great increase in the number of children who I'm seeing, from the ages of usually 15 to 19, who are looking to potentially improve their appearance, definitely.
And what kind of surgeries are they typically asking for?
Well, I'm a facial plastic and reconstructive surgeon, so I do facial cosmetic surgery. That's the primary thing that I do. So in that age category, you're usually talking about seeing girls and boys who are looking to do something like a nose job or a rhinoplasty to help improve their self-confidence. And then also another common procedure in that age range for me is for children who have prominent ears, the ears that flare out a bit. And what they want to do is they want to bring them back closer to the head so that they're less obvious to other children. It's a lot of times it's because they get bullied or teased as well.
Got it. Dr. Yoon, what about you? Have you also seen a lot of teens?
Well, we get a lot of calls for teenagers, but I purposely do not see anybody under the age of 18 for cosmetic surgery. The ones that we do see that I think are very reasonable, because I do all face and we do body surgery, are sometimes we see teenagers who have large breasts that make it so they really can't do activities that they want to. They cause back, neck, and shoulder pain. So breast reduction surgeries, I think, are reasonable. Other surgeries, like Dr. Giacono mentioned, with ear pin back, I think doing that in somebody who's a minor, I think, can be reasonable. But there are so many surgeries out there that are being done on teens that really shouldn't be, and cosmetic treatments, even non-surgical treatments as well.
Like what?
Well, we all know about some of the celebrities that we see who have lips that are enlarged, sometimes to excessive proportions. We know that there are girls who are having breast augmentations for their 16th birthday. According to the American Society for Aesthetic Plastic Surgery, last year there were over 100,000 people under the age of 18 and under, who've had cosmetic procedures. I mean, and to me, that's a staggering number, and it's a very disturbing number.
Now, I think that when you're talking about some of the celebrities that we see, people like Kylie Jenner may come to mind. And let me just bring up a comment here, too, from one of our viewers. Actually, you know what? I just lost that comment, so I'm gonna have to come back to it. Oh, here she is. It's Susie on Twitter, who said, "As the parent of 3, I think that taking selfies and the Kardashians have majorly played into it." When we asked what's really behind the surge in teen plastic surgery, what would you say? What would you say to that, Judy?
Well, certainly, I think that beauty is associated with being loved, and who doesn't want to be loved? And so when teens go into the procedure, they're thinking that something's going to radically change. It's going to increase their popularity, or they're going to get that guy or that girl that they've been wanting to connect with, or that they're going to somehow increase their beauty status and other forms of status as well in the community. So one of the things that I notice is that there's a large number of people who have what is known as body dysmorphic disorder, that they see themselves, their self-image is distorted. I like to call it the cracked lens of perception. So they're seeing something that may not necessarily be that other people may view as a flaw, but they're seeing it because their self-esteem is impacted, and so therefore their view of themselves gets distorted.
Kayla Ann, why don't you tell us about the surgery you had and why you underwent it?
I had a rhinoplasty done about last summer, and it was like a bunch of reasons for me for why I decided to, why I was interested in doing it. I'm an actor, so I'm performing very often, and I'm performing all the time. And for me, I didn't really notice it growing up, and I found out along the way that, like, my nose had been broken. And when I look back at baby pictures, you could see that my nose looks in baby pictures the way it is now after the surgery. But for me, I was very self-conscious when I would perform. I go to performing arts high school, and I would always feel like I couldn't focus on acting or the scene I was doing because I felt like everyone was looking at me. And I felt like, for me, I didn't want to be worried about that. I didn't want that to have to, like, hold me back from pursuing things because I didn't feel so confident or like I wanted to just jump in. I felt like if I always had to think about it, it would just hold me back. And now that it's done, I could not feel better about it. I'm so happy.
So you feel like it has changed things for you for the better?
Yes, 100%. I'm like, once I started becoming more and more upset with my nose, I became very quiet. I didn't really like want to hang out with my friends. I wouldn't go out to dinner. And now I am so happy. I can do everything without feeling self-conscious or just having to think twice. I feel like I'm like living my life the way I want to be.
Well, do you feel pressure? You said that you go to a performing arts high school, that you are a performer. Do you feel pressure to look a certain way? And, is some of that coming from the way that so many Hollywood actors and actresses and models and the people that we often see on television screens or on magazine covers and how they look?
For me, I think it was a lot because since I'm little, I didn't like my nose, but I do think like the media can play a big part of it. I didn't get it done because I wanted to look like someone else. I just wanted to feel like myself, and I wanted to do it for me. I wasn't trying to look like someone else because they had this nose. But I definitely think that the media can play a big part for other people because there's so many things that are retouched or perceived differently, and there's so much pressure to look a certain way.
And Christina, what as a parent really helped you make the decision, or what factored into you deciding whether or not to say yes and to allowing your teenage daughter to undergo surgery like this?
There were many reasons, but once my daughter was she was really staying in, avoiding situations. She wouldn't go out with certain friends. She was afraid, especially with all the social media, pictures that were taken that were, not good ones or, not to her. Like, she was always so self-conscious, and it got worse as the years went on. And she would look back at pictures and say, what happened to my nose? What happened to my nose? And so somewhere along the line, something occurred, and it started to affect her. And being that she's in the arts and always performing, it stopped her from doing certain things, and she felt that people were always looking and judging, and even if they were or weren't, in her head, she couldn't remain focused, and she was like becoming depressed. And I think as a mom, seeing her that way, that after so long, we needed to do something.
Dr. Rosenberg, do you see the point here of parents seeing perhaps their children being very unhappy with a part of their physical appearance and wanting to try to help that?
Yeah, absolutely. I think that as I'm listening to the backstory of this, it makes sense that the Kayla Ann, you wanted to restore yourself to wholeness before the broken nose. And Mom, you didn't want to see your daughter feel bad about herself and feel weird about the angles that are appearing on camera. So it seems like in this particular case, and everything is a case-by-case basis, in this particular case, I think it removed the self-consciousness and the depression lifted. And so in this particular case, it doesn't sound like that body dysmorphic kind of a cracked lens of perception situation.
And, but it's so tough too, right? Because we know that adolescence is a tough time for anyone. We're all insecure at that point as we're growing up. We are all feeling like, perhaps there are a lot of social pressures in the school environment, societal pressures that are also coming down. And so when do you really try to make a decision that is going to affect someone for the rest of their life based on the way that they're feeling as a teenager?
Well, I think that before people go under the knife, unless it's for a particular reason of restoration, in this case, your nose was broken, Kayla Ann, and you wanted to support your daughter. But in certain instances, I think that it is really important to go get some psychosurgery before you get some plastic surgery and go into what is actually distorting the person's perception of themselves, if that's the case. And in that case, there needs to be a time lapse between really delving into it and discovering what's behind it, what's the cause behind it. Because even after plastic surgery, I have some patients who have many, many different types of plastic surgery, and guess what? They never feel good about themselves. It's never enough. So in those cases, you really want to get behind the scene and look to the cause of this rather than do something physical and go for the results of it.
Dr. Giacono, do you have a lot of patients that end up feeling like they need more, coming back for a fix or for seconds or for thirds, and like it is never enough?
Yeah. Well, with teenage patients, I don't see that. And, I want to just parrot what she said, Dr. Rosenberg, is that, you have to be a psychotherapist as well as a doctor as a plastic surgeon. Because a lot of these kids, they have the wrong motivations for doing surgery. And that's any surgeon's job to figure that out. But one thing, and Kayla Ann is my patient, and I will tell you that I see this over and over again because I do operate on a lot of teens for rhinoplasty, is that when done for the right reasons in the right situation, it literally allows children to blossom. I've seen it over and over again. It increases their self-consciousness, it improves their self-esteem, and lots of times they'll engage activities, they'll do better in school, and they'll become much more out there in terms of their social life. And it doesn't guarantee them a boyfriend, it doesn't guarantee them things, but what it definitely does is it changes their lives. And I think the kids today, unfortunately, are under much more pressure than I was when I was growing up because of social media. According to the American Academy of Facial Plastic Surgery, all surgeons are seeing a 33% increase in requests for plastic surgery because of selfies and because of social media. I have a 17-year-old daughter and an 18-year-old son, and the reality is that their pictures are taken by friends, and they're placed on Instagram and Twitter and Facebook, and they don't have the control over their own self-image. And if there is something that makes them very self-conscious, it can really be very debilitating, just like it was for Kayla Ann, where she didn't want to go out with friends. It's a new era, and unfortunately, we have to be able to deal with those things, but we want to do it as a team, with parents, with psychotherapists, and we want to do surgery on children who are mature enough to deal with it. Obviously, some children are not, and those kids have to wait until they're older, like Dr. Yoon said, probably until they're 18 or even older.
Yeah, I think the control aspect is a very important point there. It's true. You can't always tell what you're going to look like, whether you feel like it's a good angle, you're dressed the right way, whatever. These pictures are going up there, and people are going to be judging you based on them. Dr. Yoon, why is it that you refuse to take patients under 18?
Well, first of all, my wife's a pediatrician, and if she knew I was doing cosmetic procedures on a kid, that'd be a problem. But even more so than that, I always question. I don't think that it's a black and white issue. For me, I don't do cosmetic surgery, including rhinoplasties, on people under 18 because I don't feel comfortable doing that. I question whether I would be able to adequately assess their psychological state. And the ones that I have operated on, even breast reductions where they have large breasts, I always get them cleared by their pediatrician. That being said, it is not a black and white issue. There are gray areas, like we have seen here, where, you may have some people who are viewers who may say, well, I don't think that this is the right thing, but I do think that Dr. Giacono is a very ethical surgeon, and I think that this sounds like a reasonable procedure. Would I have done that procedure for her? Probably not, but that doesn't mean that it's not the right thing in somebody else's hands.
And do you agree with Dr. Giacono that you have to be a little bit of a therapist as well as a plastic surgeon with your patients?
Yeah, there's a good friend of mine who said that plastic surgeons are psychiatrists with knives, and that's probably, they're not knives, they're more of a scalpel, but that's a true fact. I turn down probably 1 out of every 5 patients who comes to see me who actually gets into the door because I think that they're not a good candidate. And quite often it's because of potential psychological issues.
Wow. Now, Kayla Ann, do you know a lot of other kids, a lot of other girls or boys your age that have also had plastic surgery?
Yes, I actually find it really interesting because once I came back to school and I had my surgery, I found out at the same time I was having mine. A friend of mine's friend from another school was actually, her and her sister were both going under for rhinoplasty, except this case was the parents were forcing the daughters to do it. The mother was like, this is happening. And that, I thought that was so messed up. But also, girls from my school I don't really know their reasoning. Probably the same reason as me.
And so, I mean, is this something that people talk about too, right? We were saying that a lot of the time people end up getting some type of plastic surgery done over summer breaks. So there's time to recover. But is it something that kids are forthcoming about in your experience? Do they tell their friends? Do they tell other people in school? Or does it just become a topic of conversation?
Not a lot of people talk about it. I heard it this girl who had her nose done told her friends, I guess, but I guess they weren't good friends because they told me. So it's not like she was going around speaking about it. But yeah, there's not that many cases to make a generalization necessarily, but there are definitely people that say things they want to get done.
Can I just insert something here real quick?
Go ahead.
I think that for me, the important thing in my practice is always that plastic surgery, actually taking somebody to the operating room, putting them under an anesthetic, putting them under the knife, cutting them open should be the last, our last resort to trying to make somebody happy with their appearance. And I think that, there are, kids who may not, they may look at it because they see it on TV and, oh, it's exciting and Kylie Jenner has it done, so why can't I do it? That I don't know that they take it seriously enough. And I think that's the important thing for parents to realize is that it's not necessarily like getting your hair done. If you don't get a good result, it won't just grow back.
Yeah, and it's a serious procedure that is being done. And I'm assuming a costly one, too. Rona Berry Marin, one of our viewers, asks, are parents paying for this out of pocket? Christina, is this something that insurance covered, or was this a burden on your family?
That was another. There were so many aspects, even moving ahead with the surgery, and that was one, financially. How was I going to do it? Insurance doesn't cover it. And of course, ultimately, there was a fit for us, but it is a big decision, and my daughter, she actually has, aside of her bank account, she has this little envelope where she saves her money for just her own things, and she offered her money that she had, and it didn't compare to the amount that the surgery was going to cost, but it just showed me as a parent how, on her end, the responsibility, and she knew it was a huge financial burden, and she just felt so strongly about it, and it was, I respected that she offered the little that she had saved. So yeah, no, it's not covered, and it is a big investment.
Dr. Giacono, are there any circumstances where something like this could be covered by health insurance?
Yeah, depending upon the case, usually when there's an acute traumatic incident, it can be covered by insurance. But, generally speaking, insurance carriers will not cover, a chronically enlarged nose as a result of trauma. Unfortunately, in this case, that's what we were dealing with. But I want to say one other thing. Kayla's mom is, this is what kids really need, right? So they need to be comfortable with themselves, but they need to have a good support network at home. Have a good relationship with their parents, have an open dialogue, and really know that their parents are there for them. And you know what? At the end of the day, more than the surgeon or anybody else, the person who knows when a child is mature enough to approach these things is a good parent. So it's always important to have parents involved. And like Kayla's mom, and I really enjoyed working with her, and she was just a wonderful person.
Dr. Rosenberg, if we kind of go back to this point too, that of course does not apply to all cases, but people seeking happiness via their appearance, would you say that it's gotten any worse now, or have we always placed a lot of emphasis on appearance. Maybe now it's a little bit more prevalent just because we have so many different modes of communication and places where you can see pictures and video and things, but haven't we always been a little superficial that way?
We've always been a little superficial that way, and I just wanted to make a comment that I think, Dr. Giacono, you've handled this very ethically, and a lot of questions were asked, and it's a case-by-case basis, and clearly this surgery brought a lot of joy and a lot of relief to the family, and you in particular, Kayla Ann. But what I'm noticing is that the more we are disconnected as a society, the more we are disconnected from our family of origin, our parents, then what happens is we develop what I call a human disconnect, a hole in the soul. And this hole in the soul is then fed by superficial means. It could be fed by becoming a shopaholic or a plastic surgeaholic or something of the sort. And in this case, it's done really for the wrong reasons, because it's trying to shore up something, it's trying to fill something up that needed to be laid down at the causal level. By causal level, I mean the mother-infant connection, the parental connection, and because we as parents in general as a society, we're doing less connecting, we're more on our cell phones, we're not nursing our babies, we're not staying home. I'm talking attachment theory. When we're not attaching properly to our infants and our children, then we don't give them the tools to have a very, very strong core sense of self and a high self-esteem. I discussed this in my book called Be the Cause, Healing Human Disconnect, which hopefully will be out next month. And it's a big issue, this whole aspect of healing human disconnect. And sometimes the results are extreme. And therefore, you're seeing people go into surgery for really disastrous reasons.
Got it. Well, clearly, there's a big difference between doing something like this for the right and the wrong reasons. And people have to be very sure. But in the meantime, as we said, the numbers are rising. Dr. Rosenberg, Dr. Giacono, Dr. Yoon, Kayla Ann, and Christine, I want to thank you all so much for joining us and being part of this conversation today.
My pleasure.
Thank you.
Thank you.
Thank you.
All right, guys, stay with us. Conversation always continues here at HuffPost Live.
And that was Huffington Post Live. Was that your first exposure to Huffington Post Live, Doctor?
Live, yes. I think they film out of New York, and so I thought we'd continue the discussion. Obviously, that was our call-in guest of the day.
Yes, indeed. Well, it was you.
Yeah, it was the call-in guest. And so, yes, sometimes people have these procedures to fill that hole in the soul. And as for those of you who listen to the show, you know a little bit about the mind map and the way that we think about human psychopathology, and it's all based on human disconnect. And so when we're not connected to, when we don't have the emotional ingredients for mental health, which is attuned, parent-centered child-rearing practices based on eye contact, skin contact, breastfeeding, being consistently there for your infant, then we develop a kind of a sense of emptiness and a hole in the soul, as we call it. And that hole in the soul is what allows us to depend on and bring things in that fill us up. And so in this case, plastic surgery can be that hole in the soul filler, and many people use it to esteem themselves because their esteem is so low, and so they're thinking that if they only could look better and have a tighter breasts or skin or smaller nose. And you know what's really interesting to me, Walt, is that when you study beauty and you look at the sequencing of beauty, you go into the 3-3-3, 2/3 forehead to nose,
Yes.
and
Yes.
then 1/3 from the bottom of the nose to the lips. And this is called the Fibonacci sequence of beauty. And you find these numbers recurring in patterns in nature. And so, in essence, what people are trying to replicate is the baby face, because the baby face is really that 2/3, 1/3, with the wide eyes and the short nose and the high forehead. And so when people go under the knife, I have this kind of a feeling that they're trying to recapture something of a childhood look, so maybe that they want to start again and clean the slate and go back to that period of time. I never really thought about it that way, but I'm thinking about that right now. That really what they're wanting to achieve is these baby-like proportions, because babies are cute and babies are loved, and we want to be loved.
Well, I want to be cute.
Oh, yeah, I know. But you already are, so.
Oh, thank you.
Put that knife down.
I want to go back to at the end of the People magazine article that is entitled "The Newest Back-to-School Must-Have for Teens: Cosmetic Surgery." This came out late last month in People magazine, and the quote to Dr. Judy was, "Our culture makes it so socially acceptable to seek plastic surgery, and because celebrities create the idea that if you are beautiful and perfect, you will be rich, famous, and loved. Teens easily associate this plastic surgery, quote, solution as a pathway to feeling better."
Right, and it's not a pathway to feeling better, because once that procedure is over, they're not feeling better and they need to do something else to make them feel better. And the list is long. It could be...
Right, it grows.
It grows. It could be drugs, sex, rock and roll, and anything else in between. So the prevention to all of this, and I'm a big fan of prevention, is if you're parents, be there for your children. If you're parents, then definitely pay attention to the words that you use, because words tend to scar, literally. Speaking of surgery, you can really scar up your kid by calling them ugly, calling them stupid, telling them that they have a big nose, that they're too fat, and there's a lot of damage that comes down upon that child, and then they end up in a psychologist's office, and then I have to undo and decode all that psychopathological, I call it the psychovirus, because it gets in their head and causes them to believe that they're stupid, ugly, fat, and so on.
So you think that the phrase that we all learned as kids, "sticks and stones may break my bones, but words can never hurt me," is
not true.
Obviously not a very true statement at all.
Not true. I recall a case where I had a family in, and the mother was extremely critical of her daughter, and she kept putting her daughter down, and I wanted to hear what that sampling looked like, and yeah, it sounded like. And I didn't mean to be cruel, but I wanted to really see it in live action so that I could make the intervention, because I knew that was going to happen once they left the office anyway. So the mother started in on the daughter, and the daughter
right there in your office.
Right there in the office, and she decompensated. And I turned to the daughter and I asked her how those words made her feel, and I created enough safety for her to share her feelings. And I helped the mother connect the dots that those words were actually like throwing acid in her daughter's face and scarring her.
Right.
And sometimes you just have to put it that way, because people don't get it.
No.
People don't connect those dots, that what comes out of your mouth could be a bridge and a connector and a place where people can interconnect. Or it could be literally, words can be like scissors, cutting or demeaning or devaluing and destroying. So words are really, really powerful.
You know, folks, so you're listening to Dr. Judy, WTF, here on ubnradio.com, and this is a call-in show, and it's not too late for you to call in. So if you want to call in, our direct number is area code 323-843-2826. We'd love to hear if you've had plastic surgery or if you've considered it and haven't. And maybe you just need not plastic surgery, but psychosurgery. And the Psychological Healing Center can certainly help you with that, with Dr. Judy and her staff.
And just for everyone to know, I have a wonderful, wonderful staff of interns. They all have master's degrees, and they're working on their PhDs, and they've been trained in the mind map system. And the Psychological Healing Center continues to grow. We do teletherapy. We do Skype therapy. I have people from all around the world who who I have the honor of therapizing, because we have that wonderful instrument called the telephone and Skype.
And a lot of you have found Dr. Judy and the Psychological Healing Center from our show, and we very, very much appreciate it.
Very, very much
and
so.
of course, a lot of you guys are watching. We have a lot of patients that have actually watched all of our shows on YouTube. So you go to Dr. Judy WTF on YouTube, and while you're doing that, why don't you saunter over to Facebook and like us at
Thank you all for reminding the audience of that. That means a lot to us.
It does.
Obviously,
Yeah,
and
it
tweet
does.
us out.
And we're Twitter, Dr. Judy WTF as well.
Absolutely, and of course we appreciate referrals from the audience. And so one other thing that I wanted to mention is that many months ago, or maybe even a year ago, we had a guest on who underwent plastic surgery, different kind. She did a gastrointestinal bypass. And to this day, she suffers from not being able to eat, and she eats through a feeding tube. So here was this beautiful young woman. Remember our guest who came on the show? And she talked about wanting to lose weight. And so what the doctor recommended was for her to get this, I think it was a gastrointestinal bypass, or they shrunk her stomach, and they literally hurt her interior so badly that today she suffers from pancreatic pain, and she cannot eat, and the only way that she can eat is through a feeding tube. She can only have liquids, and she's in and out of the hospital. She suffers tremendously. Her children suffer tremendously.
The whole family's impacted.
Right, and of course the doctor had her sign a release form and takes no responsibility. It's one thing to have someone sign a release form. It's another thing to be inhumane and to not even ask your patient, how are you doing? What can I do to help? I'm so sorry that happened. What can I do to help? It's just unconscionable.
Or simply just take responsibility. Hey,
that would be a great thing.
I messed up with an F.
Yeah, absolutely.
Yeah.
Hippocratic Oath. What happened to that? I have no idea. So that even hurts the individual more, because there is an example of someone who she commissioned to help her change her life in a good way, and then that person ends up being her, I'll just say it, her hacker. Okay, and then she has to live with that horrible anger. And she can't really spew her anger at the doctor because he's disappeared, won't take her calls, of course. And so therefore she has nowhere to turn but inward, and then the depression starts and the shame starts, and it's a very vicious cycle. So please choose your doctor carefully and make sure that your doctor has a quality that's really, really rare called empathy.
Well, not only that, some of the articles, and we talked about this when we did our makeover, fakeover, is one, make darn sure they're board certified.
Absolutely.
And secondly, they are also certified in the procedure that you seek.
Right.
Because they have subspecialties. Okay?
Good point.
And granted, you may spend a little bit more for that caliber of a surgeon, but remember, it's the only body you got.
Right.
And you know what? You got to wake up in it and with it every day.
Well worth it. And I know that there's a service called Care Credit. And so if you need to spend a little bit more than you really bargain for to get that right doctor, I believe that there are ways that you can borrow that money from a kind of a Care Credit card service and pay it back slowly. Well worth it, because at the end of the game, it costs you money anyway. You've got to go get it redone, and then you've got to go get psychological care, and on and on and on and on. So don't save money. Don't try to save money on that one.
Well, it's being penny wise and pound foolish in some respects.
Mm-hmm.
The thing is that I think with the just going back to some of the reasons why plastic surgery is becoming more prevalent is that people are today, the millennials, are born into a sexualized womanhood of girl power. The millennials have come of age in a society increasingly injured to the exploits of surgery-enhanced reality TV stars. So again, social media, which was alluded to in the show on Huffington Post. Mm-hmm. Hey, I'm on Instagram. I've got a selfie, right? And it's, oh my gosh, it doesn't look quite what I want it to be, or what it should be, or what I expect it to be relative to all these reality TV stars.
Right.
Never mind that they've got an amazing makeup artist. They've got an
Right.
amazing hairstylist.
Right.
Maybe the lighting was just perfect for
Absolutely.
that photo. You don't understand, and we're not even talking about photoshopping. Okay, there's a lot of things you can do just for the shot, and they spend an absolute inordinate amount of money. Or an actress or a model has a personal trainer, and they're working their buns off, literally hours a day, 4 or 5 days a week, just to get what they've got. They are working. This is their job.
Right.
And is it absolutely impossible for you and I to have a stylist, to have a personal trainer, to have a makeup artist, and so we look like we're literally $1 million 24/7.
There was an interview with Cindy Crawford, and the lady said to her, "You look so beautiful, Cindy. It's incredible. I wish I looked like you." And she said, "I wish I looked like me too." Meaning that by the end of the makeup and the hair, she looked incredible, and still a very beautiful woman, of course, but completely natural without the makeup and the hair, and of course not as glamorous. So when the new norm is to have this perfectionistic look that is of the caliber of Kim Kardashian, Miley Cyrus, and whoever else, right? Then the people who don't have the plastic surgery start seeing themselves as really below the grade. Really, really below the grade of the beauty grade.
Yes, and it's an amazingly high bar and a standard that is just literally unachievable. What's interesting is even the mentality's changing. This one dad says, I was going to buy my daughter a brand new car for Christmas. But you know what? Like every father does when my daughter, for Christmas or graduation, he says, but you know what? This plastic surgery, which I'm spending the same amount for, will last her a lifetime.
Interesting. And very interesting. And sometimes people regret the plastic surgery because it sometimes at the end of the day people regret not looking natural. And natural ultimately is beautiful. And so as you mature and grow and start really understanding that what is beautiful is health, and everything coming together in a proper, natural way, then sometimes people who've undergone plastic surgery will start noticing that it's nice on the camera, but it doesn't quite fit because now it throws this off and that off. It's like remodeling a house, right? You do the living room and then now the dining room doesn't look so good, and then you do the dining room and now the kitchen doesn't look so good, and it just goes on and on and on. So truly, if you're going to go under the knife, make sure that you're going under the knife for the right reasons, that you've sought some sort of a psychosurgery beforehand, and third of all, that you're really in the hands of an artist, not only a surgeon, but somebody who understands the art of proportion.
My father was a very, very prominent internist here in Los Angeles, and he said something to me years and years ago, which has stuck to me. And he sees lots of patients with that issue, and he said that if you have a facelift, you are going to need another facelift to hide the results of your first facelift.
Wow.
So the issue and implication was that if you have a facelift, you're going to need to have another one sooner because it all drops more and it just perpetuates itself. So if you want that look from what a facelift is doing, you have to realize that you are committed to that look, and therefore down the road you're going to have to redo your look and get an upgrade because you've already done it once. And I thought that was amazing that if someone has a facelift, they're stuck. They're going to have more.
Didn't know that, but it's a great marketing tool, right?
Absolutely.
I mean, just repeat customers.
Yes, it's and you have to remember, folks, we're talking about there's two kinds of surgeries when we're looking at overall, but primarily teens. The first is reconstructive. Okay, that's surgery that's needed, right, from an accident or a fix from a birth defect, or scarring or something like that, or maybe you had your nose broken, right? So you're getting your nose fixed, and that actually is the number one plastic surgery is a nose job.
Right.
Then there's cosmetic, which simply enhances your looks, and that's very elective. And ones that we're really talking about hearing, is it really necessary?
And I think there are different gradients, because if somebody's suffering because their ears are profusely large and they're standing out, and it would really help their self-esteem to get that pin back look, if that's going to make a difference to that child's life, because they're being made fun of. And we're getting more and more cruel in the bullying thing, right?
We are.
And
And bullying was a lot
making
of
fun
articles
of,
bullying,
right?
and they want to address that.
Right. So certainly we have, we can see how certain children who have huge noses and they just, they don't feel good about themselves, and they're feeling ostracized because of some body part that's disproportionately large. You could certainly have empathy for that. I'm talking about people who do the extra mile, instead of having their only their nose done, now they want to have some cheek implants, and they want their chin a little pointier, and now they want to have some collagen placed into their lips, and it just doesn't stop.
I want to touch on this really fast, and then we've got to go to our song. Is like, remember, what is body image? You have to sit there and ask the question, what is body image? Remember that, your body changes with age, and if you get the feeling when you're changing in the locker room of how you feel of trying on a new bathing suit, your body is unique and special, and sometimes we're all too critical of our bodies, and it's often a major source of frustration, sadness, anxiety, and even sickness. And so, you might want to just accept your body, as it is.
Or how about
and be
just
realistic.
Work out and
Yeah, right.
make some time during the day to really do something that's not only going to make you look good, but it's going to make you feel good. And when you feel good, you look good. So health is beautiful.
It is. And, you're worried about how your body looks. Well, everybody else is worried about how their body
Right.
looks. They're not really that concerned about how your body looks. They're more concerned about their own. So, granted, others are making, and there's bullying and other issues, and peer pressure is horribly challenging. Just put it all in perspective. And again, we talked about having some psychotherapy before going under the knife, because it's a procedure, and it's a very, very involved one.
And just for a little heads up, next week we're going to be talking about anorexia and bulimia and body image. And I was asked to
and had an article in People Magazine.
In People Magazine.
Yeah.
I'm getting some really nice
Yep.
publicity. Thank you, People Magazine, Huffington Post. Really appreciate you. And so in this particular article, we discuss video characters and how they transformed some video characters into regular people body images. And so I was asked to comment on how these characters in the media and so on that advertise slim, beautiful, how it impacts young women in particular and their body image. So we're going to be talking about that next week. And so if I've missed any questions from the audience, please feel free to write us at, you can contact us at drjudywtf.com, and I'm happy to answer any emails. And of course, you can call in and call me, and we are available to cover any questions that haven't been addressed or answered for you.
Yes. So stay tuned for anorexic and bulimia, and we are now going to shrink that tune, which is a standard thing and a procedure we do here on the show. And today we're going to do the song Plastic Surgery Slumber Party.
Of course we are.
Vinyl black stilettos and fake eyelashes, blue eyeshadow, everything perfectly matches. Touch my plastic face and see what happens. I'm hiding from the world behind Chanel sunglasses. Do I look fat?
So this is all about that false self, because underneath it all, there's not much of a sense of self. So everything has to be slapped on. The vinyl black stilettos, everything's fake, and still at the end of that little procedure, they look in the mirror and still wonder, Is there more something wrong with me? Do I look fat?
Do these jeans make my butt look big? Limo tinted lipstick secrets, knife thin, can you see us? Crushed diamonds, dollar bills. In my purse is every pill. Fake smiles, tabloid, tasteless, pretty Porsche on a Fendi face list. Plastic noses, mannequin poses, expensive clothes. My face is frozen.
Well, there's the Botox.
There
My
it
face
is.
is frozen,
Yeah.
which is a metaphor for expressionlessness, which is a metaphor for this kind of a sense of deadness. And in my purse is every pill, meaning that, on top of all of these hole-in-the-soul fillers, they're still not feeling well, so they have to pop a Xanax
Or numb
pop
themselves.
something,
Yep.
Valium.
I had a friend of
something.
mine, I went to his wedding, I hadn't seen him in a couple of years, and he had so much Botox, I couldn't believe how different his face looked.
Yeah.
I was blown away.
Right.
It was like, oh my gosh, you're like a different person. Plastic parts, broken hearts. Masterpiece, scalpel, please. Pink razors, so vain. Let's have a sexy party. Nose jobs and champagne. Sounds like a party.
Well, the pink razors is interesting because I have patients, of course, who cut themselves, and sometimes they have these razors that hang around their, it's like a necklace, and so
in other words, you're saying that they're ready for action anytime.
hell, they're ready for action. So look at the juxtaposition of a party and champagne and the razors. So how could that be? Everybody sounds like they're so beautiful and having so much fun, and yet they're suicidal and needing to cover their feelings and self-medicate.
Pink sorbet, popsicle lips. Perfection is tucks and nips. Collagen pumps and lipoed hips. Hollywood glamour, lip gloss tricks. Surgery scars and beauty marks. Botox amusement parks. Pageant parade, suicide past. Beauty will never last.
Yeah, they can't just do it enough. There's just, Botox amusement parks. There are Botox parties, literally. And it's just the illusion of really how painful they feel, even though they're doing all of this to look better. It's not working.
Don't touch me, just fix me. I love this line. Don't touch me, just fix me. Pink razors, so vain. Let's have a sexy party. Nose jobs and champagne. Sounds like a party. Pink razors, cocaine. Sounds like an LA party. Rock stars are so lame. Sounds like I hate that party. Let's just have a party.
So on top of it, let's deny everything. Let's just, I'm suicidal. I don't feel beautiful. I try this. I try that. Am I still too fat? So nothing's working.
No.
Don't touch me, just fix me. In other words, don't get close to me, but just fix me superficially so I'll be able to keep on keeping on.
Yeah, or at least look good even though I feel like crap inside and I'm
Right.
popping drugs and cocaine and pills and anything else.
It's the outside looking good and the inside not so good.
Absolutely, that hole in the soul.
Right.
And that is our show, folks, for Dr. Judy WTF, What the Freud. Thanks so much for tuning in. Next week, we will be addressing more with anorexia and bulimia, so be sure and bone up on that one. And the song we just shrunk was Plastic Surgery Slumber Party. And we're going to close out with our song. And if you want to write us, just info@drjudywtf.com. I am Walt Lusk, your host, with Dr. Judy Rosenberg. So until next time, God bless everyone.
Vinyl black stilettos and fake eyelashes, blue eyeshadow, everything perfectly matches. Touch my plastic face and see what happens. I'm hiding from the world behind Chanel sunglasses. Do I look fat? Limo tinted lipstick secrets, knife thin, can you see it? Crushed diamonds, dollar bills, in my purse is every pill. Fake smiles, tabloids, tasteless, pretty Porsche and Fendi faceless. Plastic noses, mannequin poses, expensive clothes, my face is froze. Plastic parts, broken hearts, masterpiece, scalpel please. Pink razor, so vain, let's have a sexy party. Nose jobs and champagne, sounds like a beauty party. Pink razor, so vain, let's have a sexy party. Nose jobs and champagne, sounds like a augmentation is tucks and nips, collagen pumps and lipo hips, Hollywood glamour, lip gloss tricks, surgery scars and beauty marks, Botox, amusement parks, pageant parades, suicide past, beauty will never last. Pink razor so vain, let's have a sexy party, nose jobs and champagne, sounds like a pink party. Pink razor so vain, let's have a sexy party, nose jobs and champagne, sounds like a pink party. Don't touch me, just fix me, don't touch me, just fix me, don't touch me, just fix me, don't touch me, just fix me. Pink razor so vain, let's have a sexy party, nose jobs and champagne.